Hey, it's me, Dr. G, and welcome back to Friday Morning Rounds. Yes, I've been on a bit of a hiatus, but I'm back. I know you missed me, and I missed you too. Where to start? So much has been going on, and I promise to catch you up on everything soon. All I can say is that many blessings have happened in my life since we last spoke, and hopefully there will be more to come. My job, as usual, is to keep you updated on all things health as much as possible. The hottest topic in health right now, hands down, is the coronavirus vaccine. And probably the biggest questions I'm fielding in my medical practice currently are, number one, what is the coronavirus vaccine? Number two, how safe and effective is it? Number three, what are the side effects? And number four, who's first in line to get the vaccine? Let's break this all down. The vaccine itself is a new type of vaccine called an mRNA vaccine, and it works by using a tiny fragment of genetic code from the pandemic virus to teach the body how to fight COVID-19 and build immunity. This novel vaccine is just about as novel as the SARS-CoV-2 virus was itself when first discovered at the end of 2019. An mRNA vaccine has never been approved for widespread use in humans before, so it is important to know that this vaccine is unlike those that we've been accustomed to getting, example, for influenza, pneumonia, shingles, etc. The Pfizer vaccine was approved by the United Kingdom earlier this week on Wednesday, making it the first country on the planet to approve its use. Distribution starts next week. Here in the US, the Food and Drug Administration, FDA, is set to decide on Emergency Use Authorization, EUA, of the Pfizer vaccine next Thursday. The other vaccine that is commonly talked about is by Moderna, and their FDA decision date is set for December 17th. Regarding the safety of these vaccines, the 95% effective rate of both the Pfizer and Moderna vaccines is based on preliminary phase 3 results. Tens of thousands of patients across diverse global populations have participated in the studies thus far, and this gives us the confidence that we are finally getting the upper hand on this pandemic. Now, transparency is key. Most people will escape severe side effects, defined as those that prevent daily activity. For example, according to an independent board that conducted the interim analysis of Moderna's trial, found that severe side effects included fatigue in 9.7% of participants, muscle pain in 8.9%, joint pain in 5.2%, headache in 4.5%, and fevers of 39 degrees Celsius to 40 degrees Celsius in fewer than 2% of participants. I think that vaccine administrators and physicians must alert people that they may experience side effects, but that the duration of them will be temporary. This would go a long way to help people trust they are being told the truth. Long-term side effects of mRNA vaccines remain theoretical at this time. That being said, I believe the demand for the coronavirus vaccine will be huge. With the reported 95% efficacy of both mRNA COVID-19 vaccines in making sure you don't get the infection, this certainly beats the alternative of contracting a disease that can potentially kill or cause long-term health concerns for yourself or others. Now for my last point. Where are you at in the pecking order of getting the vaccine? Generally speaking, the elderly as well as medical workers will be given top priority. Following those groups will be those with medical issues, then groupings by age. In fact, this past Tuesday, the Advisory Committee on Immunization Practices, ACIP, met to discuss distribution of the vaccine. The ACIP is a panel of outside experts that advises the Centers for Disease Control and Prevention, CDC, on vaccines. ACIP members voted 13-1 to approve a recommendation calling for healthcare workers and residents and staff of long-term care facilities to be the first Americans to access the vaccine against the novel coronavirus once it is authorized for use by the FDA. According to Politico, CDC data presented during Tuesday's meeting showed that at least 243,000 healthcare workers have contracted the virus and 858 have died from COVID-19. In addition, the Centers for Medicare and Medicaid Services CMS data shows that as of the week ending November 15, up to 500,000 residents and staff in skilled nursing facilities had been infected with the virus and nearly 70,000 had died from COVID-19. There is no doubt that individual U.S. states have been paying close attention to ACIP's vote, as they must submit their first orders for coronavirus vaccines to the federal government by today, December 4th. To make this all work, here are my takes. Number one, be patient and don't panic. Many people will have questions about when they will be able to receive the vaccine. I do worry that some people may try to seek early access or try to shortcut the prioritization schedule entirely. The logistical issues are challenging themselves. Regardless of where an individual is on the priority list, we must continue to follow the 3 W's: wear a mask, wash your hands, and watch your distance. The general public will likely not see this vaccine until mid-2021. Number 2, support each other. Set a good example for yourself, your family, and your community. Larger health systems will have to collaborate with smaller organizations to ensure resources are utilized to improve access to vaccines, health equity, and immunity building within local populations. Number 3, education is paramount. Most patients trust their doctor as their number one source of information. My fellow physicians and I are doing our absolute best to educate ourselves regarding the vaccination rollout efforts and combat misinformation. Well, that's about it for now. I had to go a bit longer since I haven't seen you all in quite some time. Have a safe weekend and peace out.